Can you hear the school bells ringing? School is about to start, and that very act of hearing plays a major role in a child's ability to learn successfully, as well as develop speech and language skills. That being said, more than 1 million children in the U.S. have hearing problems, with ear infections as the most common cause of hearing loss. Dr. Regina Presley of the Cochlear Implant Center at GBMC joins us now with more. Dr. Presley, welcome.
Thank you for having me.
I'm glad to have you here. So, ear infections leading to hearing loss. Even as a mother, I haven't heard of this, and I feel like there's a lot of parents that haven't heard of this. How bad does an ear infection have to be for that to happen?
So it really depends on how much fluid and how much infection's in the ear. So it can be as much of a mild as much as a severe impact on hearing. So it can be very significant.
And how many people, or children, I guess, are affected by this?
A lot of children are infected. Unfortunately, if kids aren't showing fevers or discomfort, oftentimes they can even go undetected. So it's very important to try to stay on top of that. So if they're pulling at their ears, not responding well, responding inconsistently, again, or fevers, things like that, those are things that you want to pursue with a pediatrician.
And those are the symptoms that I think sometimes we see. How long do they have to persist for us to know that it's really a problem and not just something that's passing?
No, I think if you see it consistently over a day or two and they're just not themselves or irritable, it's worth taking a look at.
All right, so parents just going in and seeing the doctor, letting them know what you're seeing. With the cochlear, talk about what it is that you do at your center.
So actually we do cochlear implants, which is the final step in terms of managing hearing loss. So that's designed for kids who have more of a moderate to profound type of hearing loss. That's not as common as we see with things like ongoing ear infections, monitoring hearing for that, as well as more of the mild to moderate types of hearing loss, because all of hearing loss impacts kids both socially, academically, developing their speech and language.
Can you talk about that impact too, about when you're going into school and you can't hear why, I mean, I have an idea, but for what it is that you're seeing with students when they go to school and they can't hear properly, what are the lasting implications of that?
So it actually starts much earlier in life when we're seeing the ear infections, is that if we aren't getting the input or the input is muffled, then children aren't able to develop their speech and language skills. So not only are they not learning the vocabulary, they may not be producing it properly. They're not learning, they're not being able to learn the vocabulary they need for reading. And that obviously will impact them as they enter preschool and the school age level. That also impacts them socially, because if they're not able to interact appropriately with their peers, it's hard to make friends. And if their speech isn't understandable, it's hard for people to want to communicate with them just because they can't understand what's being said.
So what should parents be on the lookout outside of the ear infections? Just a child, what are some of the symptoms that we would encounter with a child that is not hearing properly?
So if you notice that a child is asking for repetition, they're not responding consistently to you, or maybe they're not following directions appropriately, if they have trouble interacting socially, if they're not developing speech and language skills, just any developmental skills if they're not on target, those are good indicators.
And is there a certain age that you should start getting your hearing tested, or do you want to wait until there's actually a reason to?
So all babies are screened in Maryland. So before the babies leave the hospital, they'll have an initial screening. Anytime after that, if you have a concern, contact your pediatrician immediately for a hearing screening. Schools will do screenings preschool, kindergarten, first grade, and 8th grade.
Oh, great.
But again, during any period of that time, if you have any concerns, because hearing loss can arise at any point, you want to make sure you follow up.
Great. And we can follow up with you as well. I know that we have some of that information on the screen. Where are you located?
We're at the Greater Baltimore Medical Center on Charles Street.
All right, perfect. And you can give that number a call too, 443-849-8400. Dr. Presley, thank you so much for being here.
Thank you for having me.
Appreciate it. And we'll be right back with more Midday Maryland right after the break. Stay tuned.